Thank you very much. Honorable Minister, Dr. Osangi Hamid, the Chief Medical Director of University of Benin Teaching Hospital, Professor Darlington Obaseki, the Chairman UBTH Board of Management, Pastor Ademoja Aderoyo MFR, the Chief Medical Director of Ira Specialist Teaching Hospital, Professor Sylvanus Okorobeni, the Honorable ladies and gentlemen of the press, you are welcome to the University of Benin Teaching Hospital. It's our pleasure to have with us this morning the Honorable Minister of Health to do a press briefing. And of course, we know the issue of the day, the issue of the coronavirus. So, ladies and gentlemen of the press, we pray your utmost cooperation. And then, when the Honorable Minister is done with his briefing, we will have a little time for questions. And if the questions are more than one, the Honorable Minister will take them in batches. Thank you very much. Honorable Minister.
Good morning, everybody. Good morning, everybody. The Chief Medical Director of University of Benin Teaching Hospital, Chief Medical Director of Ira Specialist Hospital, the Medical Director of Federal Medical Center, Sabah, the Chairman of the Governing Board of the University of Benin Teaching Hospital, the representative of the Director of Hospital Services, all the Commissioner of Health and Good State, the Director of Health Services, the representative of the Nigeria Center for Disease Control, ladies and gentlemen of the press. Welcome you all here today to this press briefing. This is the first time it's holding outside Abuja, and this is a briefing that we do at least 2 times a week, severally 3 times a week. And I thank you all for your coverage of the series of briefings on the incidence of the coronavirus disease COVID-19 in Nigeria. 2 new developments have taken place since the last briefing in Abuja on the coronavirus situation in Nigeria. The first is that a team of researchers from various institutions in Nigeria, led by top scientists of the Nigeria Institute of Medical Research, NIMA, Lagos, combined their efforts to successfully perform the genome sequencing of the coronavirus strain that the index case brought to Nigeria some time ago. And the scientists proved it to be a match to the coronavirus circulating in Italy and in Wuhan, China. It is the first time this sequencing of this virus has been performed in Africa. The result has been shared with international authorities, and the Director General of the World Health Organization has extended congratulations to Nigerian scientists for this achievement. The other development is that contact tracing and monitoring in respect of the coronavirus index case presently receiving treatment in Lagos has been diligently and conscientiously pursued since the 27th of February when the case was first diagnosed. As you know, 40 persons and 20 in Lagos were under isolation and have remained free of any symptoms since then. Nevertheless, the Federal Ministry of Health, following best practice, decided to test these persons for the possible presence of coronavirus in their systems. On the 8th of March, scientists confirmed the presence of coronavirus in one of the contacts. It is my duty, therefore, to announce a new case of coronavirus disease in Nigeria, and the newly confirmed case is an Ogun State contact of the index case, but it has no significant clinical symptoms. This brings the number of confirmed COVID-19 cases in Nigeria today to 2. Since the beginning of the outbreak in China and subsequent spread to other countries, one of the important response strategies at the containment stage has been to identify all contacts, ensure their strict isolation, and follow up daily with checks for any symptoms of the disease. Following recent experience from other countries and evidence from newly published studies on non-symptomatic infections, the Nigeria Center for Disease Control advised that samples should be taken from all contacts of the index case for testing. It is in this process that this case was detected. I repeat that the newly confirmed case in Nigeria is not a new importation, but a contact of the index case who has since been in isolation and was under clinical follow-up. He presently still does not have any clinical symptoms and is comfortable, and he is being sent to the Infectious Disease Hospital in Lagos. Recent studies in China have shown that increased surveillance, self-isolation, and in particular contact tracing do reduce risk of spread because further opportunities for transmission of the virus by the infected patient in the community are limited. All other contacts of the index case in Ogun and Lagos will remain in isolation, and testing will be carried out on those not yet tested, including some in other states. The Federal Ministry of Health, Lagos and Ogun State Ministries of Health assure citizens of our commitment to do all needed to control spread of this outbreak. Since the first case was confirmed in February, the National Emergency Operations Center in Abuja continues to work closely with Lagos and Ogun State's Emergency Operations Centers to coordinate response activities. I want again to strongly advise against spreading misinformation to cause fear and panic. And the Federal Ministry of Health and NCDC will continue to provide prompt and reliable updates and initiate all measures required to protect our people. The Office of the President has also been briefed. The globally emerging lesson here is that some people who contracted HIV-19 appear to experience zero symptoms or only mild illness and will recover. However, other patients develop more severe symptoms, especially if they have other underlying illnesses or are weakened by old age. I want to emphasize that scientific studies are still going on, and even what I said now is still subject to further interrogation and examination. I want to urge all Nigerians to take care of our health and protect each other and themselves by continuing to do the following: regularly and thoroughly wash hands with soap and water for at least 30 seconds, and also use alcohol-based hand sanitizer. Maintain 2 meters distance between yourself and anyone who is seriously coughing or sneezing repeatedly. Be sure you and people around you follow good respiratory hygiene, meaning you cover the mouth and nose with tissue or handkerchief if coughing or sneezing, and also to dispose of used tissue immediately. Alternately, use your bent elbow when you cough or sneeze and you have no tissue at hand. We also urge not to mingle with people or to congregate unnecessarily, but stay home if you feel unwell with symptoms like fever, cough, sneezing, difficulty in breathing. And call NCDC on the toll-free number available round the clock, 24 hours a day, 7 days a week for guidance. The number is 0800 9700 0000. You can also move this number 0102 to 010. I want to thank you all for your attention, and I also urge all Nigerians not to engage in lengthy self-medication and to stay informed on the latest developments about COVID-19 through official channels, including the Lagos State Ministry of Health, the Ogun State Ministry of Health, Nigeria Center for Disease Control, and of course the Federal Ministry of Health. Thank you all for your attention, and we shall take some questions 3 at a time.
Thank you, sir. As stated by the Honorable Minister, we will take your questions now, but please, you will introduce yourself, the organization you represent, and please go straight to the point of your question.
Good morning, Honorable Minister. My name is Uzoruba Aliyu. I work with Vanguard Newspapers. A few days ago, the former INEC chairman, Professor Morris Iwu, did announce in Abuja that he got a cure for this dreaded disease. And now he has just told us there are some team of researchers that are researching into it. So is his own research part of the team or the effort you are putting in place, or what is the state of his own claim as of today? Thank you.
My name is Roland Isafe. I represent the Nigerian Observer. I am also aware that this coronavirus does not survive in the arid region. Is it correct? Does not survive in the arid region, that is the hot region.
Honorable Minister, you are welcome to Benin. My name is Pius Musowo. I report for ITV and radio. My question is simple. Is there coronavirus in Benin?
The Honorable Minister will respond to this.
Thank you. The first question from Vanguard is with regard to Professor Morris Iwu. Professor Morris Iwu visited the Minister of Science and Technology. I did not attend because I was engaged with some other activity. But the Honorable Minister of State attended, and the message that came from there is that Professor Morris Iwu had developed a substance in 2015, which at that time appeared to be effective against the SARS virus that had plagued Nigeria around that time. And Professor Morris Iwu came to discuss with the Minister of Science and Technology if that product would also be effective against coronavirus. He didn't say that he had a cure. He was asking if it could be. And then the question of the ownership, that it was being further investigated by scientists in the United States. So Professor Wu was not working with the Nigerian researchers. He had done his own research earlier. This research was done here by led by the Nigerian Institute of Medical Research and by Lagos University Teaching Hospital and NCDC and one other research group, I think based in a private university. That's the consortium that performed this research and did this genome sequencing. The other question is about the survival of the virus. They call it the novel virus. Novel means it's new and not much is known about it. Scientists are frantically trying to study it. They have done the genomic sequencing and trying to understand the behavior of this virus. One of it is it doesn't seem to cause serious disease with some people. The other and others have mild disease and others have very severe disease. Those are facts that are emerging. About the survival in arid regions, I cannot tell. You said you are aware. I don't know how you became aware of it, but I myself am not aware of much of the behavior. We are waiting for scientists and researchers to tell us more about the behavior. Where it survives, how long it survives on surfaces, we don't know yet. The third question is whether corona is in Benin. We haven't seen anybody with symptoms. We cannot tell that it's not here. All we know is that it has affected someone who was in Lagos. The person had been to Ogun State, and we are doing contact tracing to see all those who had any connection or any activity together with that index case.
Thank you very much, Minister. Do you have a further question?
My name is Francis Omegbu. I write for Daily Independent. Please, I want to find out how many quarantine centers you have in Nigeria, and whether you have anyone within the South region here. Thank you.
My name is Patrick Ochoga. I report for Leadership. Honorable Minister, beyond the efforts to contain this virus, are you thinking towards mitigating it, like we read in efforts of some other countries affected by mitigation?
Honorable Minister, my name is Usman Bello. I write for the News Newspaper. I want to know in terms of what, how much have you committed to the effort in mitigating this virus?
Thank you. The first question is about quarantine. The government has a lot of quarantine stations everywhere in the country, and they are generally for different disease patterns. IRWA has a well set up and well organized quarantine, and it is for the specialized, as you know, in Lassa. Asaba Federal Medical Center also has one that is very well done and well set up. Depending on the problem that arises, it can be used for that. So there are others here. So yes, we do have that for different disease patterns. There are some for TB and for other kinds of ailments that you need to put under close observation. Now, what other steps are we taking? The steps that any government takes depends on the challenge that it faces. If you have just one case, as we have had up till now, there are certain measures you take. We do not take panic measures. We do not take measures that go over and beyond the threat. If you have two cases as we have now, we are very observant and we watch. Now, those countries you see taking very stringent steps like locking down cities are the ones who are having large numbers of transmission every day, 50 a day or more, or the disease is spreading very widely, so they have to take measures. And we also know that China had to take a lot of drastic measures too. They built a 1,000-bed hospital in 10 days. Those are drastic measures people take when you have a drastic problem In our own case, we have a watchful waiting posture. We have a very active emergency operating center. We have had 2 interministerial and multi-sectoral meetings which have put all the stakeholders together, both from the ministries and from the agencies, to prepare ourselves and prepare our options, the options we need to take if depending on how the situation develops. But our number one option, our number one front line is preventing the importation of this virus. You know that this is an imported virus, it's not indigenous here. So the first step is to prevent the importation, and we have a frontline activity of screening every person who comes in, making sure they sanitize their hands. We question them, we give them a self-reporting form to fill, know if they have been to a high-burden country, and subject them to more questions if they have been to a high-burden country. The question of how much, yes, the government of Nigeria has committed about 1 billion naira to this response. Every amount that was requested by NCDC and by Port Health Services have been granted by the presidency with no delay at all. And the money is available and is being used and utilized. We also have promises of donations from several organizations, private sector, and we got the letter the other day that we can apply to use some of the global fund that's allocated to Nigeria for this response. But we have to tailor the request we made for money to fit with the threat that we face in this country. So we continue to observe and see how it develops and focus very strongly on preventive measures and also on early detection. The second case we found now is a product of very early detection and stringent contact tracing and supervision.
Thank you very much. You still have comment.
Osako Goba is my name. I'm journalist with the People's Daily Newspaper. Please, sir, I want to find out if the federal government is already working on how to get a vaccine for this coronavirus.
Good morning, sir. My name is Kevin Victor Opasar. I work with the National Transition Authority. So the first development you talked about had to do with the sequencing performed by a group of researchers in Nigeria. Is this looking at getting a cure for the coronavirus? What effect will it have in containing the spread of this disease?
My name is Fatima Sado. I work with the African Independent Television, AIT. So I want to know what happened with the driver who drove the Indian space, the Italian and the Nigerian. Because if other person of the state can can contact the infection, I wonder the driver who drove him from Lagos Airport to the state. What happened to him?
With regard to the vaccine, many scientists are working hard on trying to get a vaccine. In order to get a vaccine, you have to understand what you are vaccinating against. And besides the need to have a vaccine, the sequencing helps to understand the nature of the virus and its connectivity, because from the sequencing you know how closely related it is. It might be to the SARS virus, or to the MERS virus, or to the common influenza virus, so you know the relationship, the similarities. So that helps to fast track development of response. Getting the vaccine is also not easy. By the time you get the vaccine, you have to test it. You have to test the efficacy, test that it works. You have to test the safety, that it will not cause other problems. So it takes quite a time, a period to develop vaccines. But I can assure you that scientists all over the world are working hard, and I have read reports and also heard reports that scientists in the US have gone very far in trying to fast track the development of vaccines. With regard to the driver, the
second case that we identified right now is a person who had particularly close contact with the index case in the course of work that they were doing. So the driver, I think, couldn't have had many more than a casual contact, and that was not the only driver, but he's among those being monitored. He's among those being closely monitored, because when we do contact tracing, it's anybody, even the hotel where he stayed in overnight, the receptionist who received him, the people who served food, they're all among those who are on the list of contact tracing. And in the meantime, the room where he stayed in Ikeja, the hotel, has been decontaminated. You have to fumigate it and decontaminate, because we are looking at the possibility of virus shedding in that room. You don't need to prove it, you decontaminate. So the contact tracing is done by experts, expert epidemiologists, and they track down every contact, and they are very thorough with it.
Thank you very much, Honorable Minister. Gentlemen of the press, we appreciate your time for being with us this morning at this press briefing. The Honorable Minister has a very long day ahead of him. We appreciate you. Thank you very much. Just to inform you, immediately after here, the Honorable Minister will be inspecting some projects here in UBTH, and thereafter he will be declaring open an international training of trainers in geriatrics program at the doctor's house. The program audience you may wish to attend that program. Thank you very much. Please, as you leave at the entrance, you will find the hand sanitizer there. And very well just in your hands. Please, let's wait for the minister to leave the hall.
We're still live from the University of Benin Teaching Hospital here in Benin City. The Honorable Minister of Health, Dr. Osagie Ehanire,